Hi and very good morning, guys. Hi- Hello from Dr. Sundaresh. So, I hope you enjoyed my first video on eye care tips in COVID. Now I am posting a second one, uh, which is again frequently asked doubts and questions about a very important condition which can occur in patients, which is cataract. So the first question will be, what is cataract? So cataract is nothing but the cloudiness of the lens which is there in the eye. Eye is compared to anatomically or structurally compared to a camera, a photographic camera, and like how you have a lens in the camera, there is a lens in the eye also. So that lens becomes cloudy. So instead of being transparent, with age and due to other reasons, it becomes translucent or sometimes even opaque. So then what happens? The light which has to go and stimulate your retina and the optic nerve does not happen, and so your vision starts to reduce. So this is cataract in simple words. I am not going into technical aspects. In simple words, this is the uh, condition called cataract. So the next question will be, what are the various types of cataract? Who all can get cataract, and why do you get the cataract? So cataract can happen in any age group. Surprising, isn't it? People think it happens only in adults and in old age, but it can happen in any age, but due to different reasons. So very commonly it happens only in old age, and sometimes it can occur in children also. And in children it can be present at birth, or it can later on develop during the developmental years. And other reasons could be trauma, which is something hits your eye, penetrates your eye, and injury can cause cataract. And another important reason is drugs inducing cataract. So mostly steroids can induce cataract. Steroids which are used for a long period of time, not very short course of steroids, but very long course of steroids can. These are some of the important causes. I am not enumerating all the causes. Some of the important causes which can, because people say, ask us how to diagnose, which age I will get cataract, and how to prevent. And so this is the types of cataract. If you understand the types of cataract, then you will not be surprised when your doctor says that you have cataract. So the next important question comes, what are the symptoms of cataract? How do I know I have cataract? Mostly the very common symptom is reduced vision. Reduced vision in the sense that too commonly reduced distance vision. So distance vision starts reducing through a period of time. It doesn't happen in a day, but happens in months, slowly, gradually progressing and increasing in intensity. And if the cataract matures and if it goes to the final stages, and one fine day you will totally lose your vision. So that is the most common symptom. The other symptom is after the cataract starts developing, people who have been having difficulties reading for near will start reading very nicely without even the help of glasses. So that is called a second sight. Second sight. So due to the development of cataract, there are some changes, plus minus happens inside the eye. I am not going into the details, which helps you to see better for near vision, but it reduces the vision in the distance. So this is the most common symptom of cataract. And what are the other symptoms? There can be increase in glare. glare, photophobia, not able to see bright lights and things like that. But of late, everybody has difficulty in driving and seeing bright lights in during night. That has become a common symptom, but people feel that that is a symptom of cataract, and they come rushing to us, fearing. That is a very common thing. That is very normal. Even normal people have that difficulty, but sometimes cataract can increase the amount of glare, which is normally, even during daylight, when you go out in the sunlight, you're not able to see, you're not able to open your eyes. So that if old people start complaining that, then that could be a symptom of cataract which is present. And there is usually no redness or eye pain unless the cataract has reached its final stages, and there is additional complications, increased eye pressure and glaucoma, what they call. Because of the cataract, you will start getting eye pain and redness and discomforts, but these are not common symptoms of cataract. So for every simple redness and eye pain, you don't have to rush to a doctor and start panicking that it could be cataract. And another important reason why patients come to us is headache. And when we say cataract, they mistake that the headache is because of the cataract. No, it's not that. It's just a coincidental finding that when you get examined for headache, there is an additional condition which we have diagnosed, which is cataract. But headache is not a direct symptom of cataract. So that people should understand, because what people think is once the cataract surgery is done, all the headaches will vanish and they will never have headaches in their life. No, it's not that. It is never like that, and headaches are not a direct symptom of cataract. So then the $1 million question comes, how to prevent this cataract? Can I do something and not get cataract? No, you cannot do that. It happens mostly due to aging, and if it is in children, it is because of genetic factors. In children, the most common question is whether I have not given proper diet to my child. So the parents start feeling guilty that they have not given proper vitamin A, and that is the reason for their care. No, it's not that. It's more due to the hereditary and genetic factors which is causing the cataract, and not any diet nutrition deficiency. And in adults also, it's like aging and graying of hair. You cannot prevent aging and graying of hair. Similarly, you cannot prevent a cataract. Cataracts which can be prevented are most commonly the traumatic ones, where you can prevent yourself from getting trauma, wear something, safety for your goggle, work related, welding related issues, and when you're doing carpentry and hammering and nailing and things like that, which can injure your eye. And so always protect your eyes when you are doing menial jobs like that, and be safe. So these are and drug-induced cataract also can be prevented when you are taking long-term steroids. Then you should have a good consult with your doctor who is prescribing the steroids, and have it under control, have regular checkups and things. So how do you diagnose the cataract? People ask whether we can ourselves know that we have. No, you cannot diagnose cataract by yourself. You have to get a examination from your eye specialist. He will examine you under slit lamp with a torchlight, whatever needs necessary, and then he will tell you whether you have cataract or not. So then what is the treatment of cataract? So the last question about cataract will be, what is the treatment? Treatment, there are unfortunately no drugs available. There is no eye drops you can use, or you cannot take tablets and cure the cataract. It has to be surgical. It has to be surgically removed, and there has to be a lens which has to be placed inside. So people again ask whether placing the lens is really important, whether we can just remove the cataract and leave it. No, usually lens is necessary. Otherwise, you will need very thick glasses to see clearly. That was done in olden days, but now it's all So cataract is treated only with surgical correction. So now we end most of the questions about general aspects of cataract. I will post another video on surgery related questions subsequently. Hope you get a lot of information on that part also. Thank you. Bye. Have a nice day.